going to follow my general principle and safety practices. So I'm going to come in, introduce myself to the patient, explain to her that I'm going to be her nurse today. I'm going to explain what I'm going to be doing and see if she needs to empty her bladder before we begin. I'm going to get her vital signs and do a pain assessment, and she is not in any physical pain and she does not need to empty her bladder, so we'll go ahead and begin. I'm going to start at her breast and look for symmetry, look at the size. I'm going to palpate around and see if I feel any hardness, any lumps, any painful areas, looking for redness. I'm going to ask mom how she's going to be feeding the baby, if she's going to do breastfeeding or bottle feeding. And she said she's going to be breastfeeding, so I'm going to pay special attention to the areola and the nipples to make sure that there's no bruising, shaping, any cracks. We want the nipple to be erect and not inverted. If she's not lactating, we don't want any stimulation to the nipples, and we also want to make sure we assess her for pain. We're going to assess and make sure that there is softness, or if they're feeling, or if they're engorged. And I'm going to talk to mom about doing good supportive bra and not putting any ice on the breast because that can decrease milk production. I'm going to come down to assess the fundus. I'm going to put one hand on the symphysis pubis and the other hand is going to palpate for the fundus. Once I palpate the fundus, I'm going to make sure that it's midline and not deviated left or right. And we also want to make sure that it's firm and not boggy. If it is boggy, I'll massage it. Bogginess could mean she's at risk for hemorrhage and other complications. And I'm also going to assess the height by measuring my fingers from the fundus to the umbilicus. Okay. I'm going to ask mom how often she's been voiding, explain to her that it's important that we know when she's voiding and how much she's voiding. So we need to make sure we get an accurate measurement. We want to make sure that she's voiding over 100 mLs each time. And tell her not to wipe. We want to use a peri bottle after she voids. And I'm going to see if there's any abdominal distension, listen to her bowel sounds, see if she's passing any gas or stools. And we're also going to be monitoring her labs. So we're going to be looking at H&H pre-delivery, and we're going to be monitoring that. We're going to look at her blood type, and if she's Rh negative or positive, and if she's had rubella immunization, and if she has not, she might have to get that before she's discharged from the hospital. Okay, so we're going to pull down the bed, and we're going to assess the locus. I'm going to have to turn her over so that I can see if there's any pooling. And I'm going to remove her pad from anterior to posterior. Whenever I remove the pad, I'm going to look for saturation, color, odor, and ask her how often she's been changing them, how saturated they've been. If they're saturated within 15 to 30 minutes of applying them, that could mean she's hemorrhaging. I'm also going to look at the pad that's underneath her for any pooling. And while she is turned over, I'm going to go ahead and clean the area and look and see if there's any ecchymosis, bruising, edema, swelling, hemorrhoids, any problems with the perineum or the anus area. And then I will apply a new pad from anterior to posterior. I can give her any pain meds if she's having pain, or we can do a sitz bath. Okay, and I'm going to turn her back over. I'm going to look at her legs. We're going to dorsiflex her feet and see if she's having any pain in her calves. We're going to look for redness, swelling, warmth in her legs and see if she's having any tachycardia or shortness of breath. That could be a sign of thrombus. Okay, so her legs look okay. We'll cover her back up. And the last thing we're going to do is look for mother baby bonding. We'll look at between interactions between her and her baby while they're together, and between her and her family, and see what her social support is and if we need to make any referrals from there. I do hand hygiene again, remove my gloves, and document.